to talk about bipolar disorder. First, what is bipolar? Without the disorder in a
It's when you have
brief
mood
definition.
swings.
Absolutely.
So one day you'll be like really happy and all, and the other day you'd be depressed, extremely depressed.
Yeah,
عليك نور.
Correct.
extreme mood swings.
Bipolar disorder is a mental health condition that causes extreme mood swings that include emotional highs, mania or hypomania, and lows, which is depression. You get mood swings such as becoming full of energy or unusual or irritable. These swings can affect sleep, energy, activity, judgment, behavior, and the ability to think clearly. While on depression, you will feel sad or hopeless and lose interest or pleasure in most activities. But in bipolar disorder, your mood shifts to mania or hypomania, which is less extreme than mania. Mood swings may appear rarely or multiple times a year. Some people may not experience mood swings. Bipolar disorder is a lifelong condition, but you can manage your mood swings and other symptoms by following a treatment plan. Bipolar disorder is treated with medications and psychological counseling or psychotherapy.
Okay. So how do you know? How does a person know he has this disorder? Well, first of all, there's several types of disorder, and they may include mania or hypomania and depression. Oh, I would like to ask: does anybody know the difference between mania and hypomania, or what does the prefix hypo mean? Like, let's relate it to hypertension.
Isn't it the opposite of hyper?
Yeah. What does hyper mean?
Like a lot?
Yeah. So
No, hypo is
No,
less.
saying
No, hyper means a lot. Hypo means less.
less.
Yeah.
Yeah. So when you have hypotension, then that means the blood pressure is lower than the normal. Same thing here. Mania is when you have a lot of energy, and hypomania is when you have less energy. Then I mean they're still bad in a type of way, but mania is worse than hypomania. Um, symptoms can cause the symptoms can cause unpredictable changes in mood and behavior. That's the whole bipolar disease, extreme mood swings, resulting in significant distress and difficulty in life. So the types of bipolar disorder are bipolar 1 disorder, bipolar 2 disorder, and cyclothymic disorder. And there's other types also, but these are the three main ones. Can anybody guess what's the difference between bipolar 1 and bipolar 2? What could possibly make a difference between these two?
The mood swings, like from angry to happy or from happy to something.
Well, bipolar, you're always gonna have mood swings, no matter what condition you're in. So, the main difference is in bipolar 1, it is more manic than depressive, and in bipolar 2, it's more depressive than bipolar. So in bipolar 1, it's you're gonna have long, more severe manic episodes, and you most likely won't even become like depression. It's not too depressive. Bipolar 1, bipolar 2, however, it's mainly depressive, but you don't reach the manic stage. You only reach the hypomanic stage if you have bipolar 2. Cyclothymic, it's a cycle. It's a light cycle, not extremely depressive, nor extremely manic. It's the place in between. You get hypomanic and then lightly depressive, and it's a continuous cycle. It's many periods. And there's this mixed stage between bipolar 1 and bipolar 2, where you may get extreme manic episodes. It's rare, but you get extreme manic episodes, and then you get extreme depressive episodes, and it's like really extreme. And it's not common. It's rare. So, yeah. And there's also other types. For example, there's bipolar disorder relating to the use of certain drugs or alcohol. These can cause a separate type of bipolar disorder with separate symptoms. Everything clear? Okay. Next slide. Bipolar disorder 2 is not a milder form of bipolar 1 disorder. As I said, bipolar 2 is more towards the depressive side, and bipolar 1 is more to the manic side. While the manic episodes of bipolar 1 can be severe and dangerous, individuals with bipolar 2 can be depressed for longer periods. So here you can have the comparison between the two. Although bipolar disorder can occur at any age, typically it's diagnosed as teenage years. In teenage years, you're getting more exposed to life, let's say, and if there's any bipolar disorder, it will most likely appear at a certain age. And bipolar disorder is a chronic disease, so it's going to continue for the rest of your life, most likely, unless you have some psychotherapy to change it, but it's most likely going to continue to the rest of your life. 1 second. Okay, and symptoms can vary from person to person. Some people are more extreme than others, and they vary over time, from episode to episode. All right, next slide. Okay, so what are the specific symptoms? What happens during the manic or hypomania stage? The mania and hypomania, as I said before, mania is in the extreme case. Hypomania is less extreme than mania. It's two distinct types of episodes, but I mean, it's like levels to it. More noticeable problems at mania is more severe than hypomania, cause more noticeable problems at work, school, and social activities, as well as relationship activities. Okay, so what makes this manic stage dangerous, or what happens during this manic stage? Why is it bad? Mania can cause abnormal, upbeat, or jumpy or wired. You get jumpy, weird, energetic, increased energy. So you're all energetic and everything. You have an exaggerated sense of well-being and self-confidence. You get way overconfident. You're just energetic, overconfident, and you might put yourself at risk of injuries or something. Decreased need of sleep. Sometimes you need sleep to re-energize and make everything be okay. But when you have mania, you don't need a lot of sleep because you still have a lot of energy to use. Unusual talkativeness. You just want to talk because you have all that energy. You want to communicate. Racing thoughts. Distractibility. Easily distracted. Poor decision making. For example, going to buy sprees, and making risks that you may not supposed to. So when you have mania, you're full energetic. You want to do things. Because usually after the depression episode, where you're not using your energy properly, now you're happy, you're energetic, you want to use all of that energy to your pleasure. So you end up doing everything that you want to do without rethinking it, and which may cause the person to make bad decisions, get into things that he doesn't want to get into. So yeah, it can be good, but it can be bad. Like mania is like if you're doing an physical activity, or let's say you're an athlete, mania would maybe be a good thing because, well, in physical activities you need to be physical. So yeah, it can be good, it can be bad. So, but the main thing that makes this dangerous is the risks that it comes with in decision making. And if you have 3 of these things, that's the symptoms. You can go back to Rayan Shway. If you have 3 of these symptoms, then you most likely are diagnosed with a hypomanic episode. Next slide. Okay, a major depressive episode includes symptoms that are severe enough to cause noticeable difficulty in day-to-day activities. We talked about the depression disorder and how effective it is. So I'm pretty sure you all know this. The symptoms of being depressed are feeling sad and empty, hopeless in children. Like, I think we all know what depression is. Marked loss of interest in feeling no pleasure in all, or almost in almost all activities. So everything you do, you're not finding pleasure in it. You don't have the sense of living. You don't have that sense of, oh, I'm alive and well, and I enjoy being alive, which can cause suicidal thoughts. Significant weight loss when not dieting, weight plan, or increase in appetite. So what happens is you're using all your energy in depressing thoughts, and a lot of energy is used in wrong purposes, and this leads to weight loss. So you're all wondering, can I lose weight by being depressed? Yes, you can. Either insomnia or sleeping too much. When you're depressed, you sleep too much. Either restlessness or slowed behavior, fatigue or loss of energy. You don't have energy at all. This loss of energy is what causes the hypomanic stage, where you want to use your energy in something nice. Feeling of worthlessness or excessive inappropriate guilt, decreased ability to think or concentrate, thinking about, planning, or attempting suicide. When it gets to that stage, help needs to be sought. I think it's all clear. Other features of this bipolar disorder. Signs of symptoms of bipolar and bipolar 2 disorders may include other features such as anxious distress, melancholy, and psychosis. Psychosis, I write about this. It's when you start it's when you start to lose the sense of reality. You just so overthink in your mind that you lose the sense of reality and you stop thinking for a moment. Psychosis is a symptom, not a disease. Just saying. The timing of symptoms may include diagnostic labels such as mixed or rapid cycling. So cycling you get the manic stage, and then quickly after you get the depressive state. Like the cycles is different from person to person. All right, next slide. Okay, children and teens. Usually in children, it's difficult to identify because through life people go through ups and downs. Like, it's normal for everyone to go through ups and downs. So sometimes the symptoms appear, but it's not bipolar disorder. So there's a certain criteria that he needs to fit into. So it's hard to tell if it has anything. The results of stress or trauma is a sign of mental health problems other than bipolar. So there's a loss of a loved one or something. You might get stressed and get, like, every time you remember, you get a mood swing because you get sad about it. That is not considered bipolar disorder. What is considered bipolar disorder if, let's say, the loss of a loved one, and then it never changes. It becomes chronic. When it becomes chronic, that's bipolar disorder. Children and teens may have distinct major depressive or manic or hypomanic episodes, but the pattern can vary from that of an adult with bipolar disorder, and moods can rapidly shift during episodes. Some children may have periods without mood symptoms between episodes. So it's different from children and adults. The bipolar disorder may vary. The most prominent signs of bipolar disorder in children and teenagers may include severe mood swings that are different from their usual mood swings. So I think normal children have mood swings. It's normal. Sometimes they're happy, sometimes they're sad. Especially when you think about babies, for example. Sometimes they're just crying and need something, and sometimes they're happy and you could play with them. So there's a big difference between the bipolar and the normal mood swings. Next slide. When should a person see a doctor? How can he tell if this is bipolar disorder or normal mood swings? Despite the mood swings, people with bipolar disorder often don't recognize how much their emotional instability disrupts their lives. So, as a normal human being, you don't want to think that you have a disorder, a mental disorder of any kind. Like sometimes, mental disorders are used as insults, and so if you are if you are feeling some kind of way and you feel like something is wrong and you get depressed, you don't want to say that you have a mental disorder because it's an insult and you don't want to be insulted by it in today's community. So people usually don't recognize that they have an emotional stability because they feel like it's their everyday life, and that's the way that they think. And if you're like some people with bipolar disorder, you may enjoy the feeling of euphoria and cycles of being more productive. Being productive is an enjoyment that people with bipolar disorder usually enjoy. This euphoria is always followed by an emotional crash that can leave you depressed, worn out, and perhaps in financial, legal, or relationship troubles. So after a period of productivity and being productive, you may have a period after that you have just a crash. You're not productive, you're worn out, you're depressed. So these are typically symptoms of bipolar. If you have any symptoms of depression or mania, see your doctor or mental health professional. Bipolar disorder doesn't get better on its own. So it's okay if you see any symptoms of depression or mania, it's okay to see a doctor of any type. All right, next slide. Causes. So, okay, what causes these mood swings? Is the big question here. The major cause, well, I mean, just like all other diseases that we talked about, one of the causes is definitely genetics. It's almost there in every disease. So, but bipolar disorder is common. People would have first-degree relatives, such as siblings or parents, with the condition. If there's a parent or sibling that you have and has bipolar disease, there's a chance that you will also have bipolar disease. Biological differences. People with bipolar disorder appear to have physical changes in their brain. The significance of these changes is still uncertain, but may eventually help pinpoint causes. So brain functions a bit. They have next slide. Okay, the main thing that I want to talk about is how the in real life feelings or in real life events can mess with your brain's functions. Or so this is what I want. There's evidence that episodes of mania may occur when levels of non-adrenaline too high and levels become too low. So what happens is, okay, let's put an example out there. Let's say there's a loss of a loved one, and actually that's an extreme case. I want to use a lighter case, but this is the only example that's on my mind. A loss of a loved one, and then this person is just so every time that he thinks about it, he just gets sad and depressed. And then what happens is the neurotransmitters being exerted. There becomes a chemical imbalance when there's just extreme mood swings, and that chemical imbalance doesn't get fixed straight away. And the main transmitters that are linked with bipolar disorder are serotonin, dopamine, and non-peripheral, also called noradrenaline. So these are the main transmitters. And if there's an imbalance in these three neurotransmitters, it may cause bipolar disorder. Next slide. Any questions so far, or are we good? I'm going to assume that we're good. Factors that may increase the risk of developing bipolar disorder, or act. Okay, so what's the risk factors that need to be looked out for, and making sure that they don't go overboard and cause bipolar disorder? The first risk factor is, as we said, having a first degree relative, such as a parent or a sibling with bipolar disorder. That's a risk factor because it runs in the genes, and if there's a chemical imbalance within the genes themselves, it's hard to control. Periods of high stress. So when there's a high stressful moment, a really stressful moment, you need to control your emotions, because if they're not controlled enough, it may cause this chemical imbalance in the brain. That's what everybody's looking out for. Drug or alcohol abuse. Hopefully none of the people here use drugs or alcohol, so I don't think we need to look out for that so much. But yeah, I think the main thing that we can take out of the slide is the periods of high stress. Midterms, anything that causes high stress needs to be controlled so it doesn't cause any chemical imbalance and doesn't send out too much neurotransmitters or too low neurotransmitters. Next slide. Complications. What's possible? What's something possible that happens if you get bipolar disorder? Problems related to drugs and alcohol use. People with bipolar disorder, like, okay, I've had enough of this. I don't want to have this feeling anymore, and uses drugs and alcohol to lose all of this. And drugs and alcohol do not make things better. Suicide or suicidal attempts, mainly related to depression. Legal or financial problems. Decision making becomes terrible with bipolar disorder. Damaged relationships. As Yusuf's example said, Kanye West. That's a big example of damaged relationships because he has bipolar disorder. Poor work or school performance. Next slide. Co-occurring conditions. So if you have bipolar disorder, what other possible conditions can you have with this? So there's always going to be a linked condition that comes with bipolar disorder. Sometimes it's anxiety disorder, eating disorders. Sometimes you just lack the sense of taste, or you don't want to eat anymore because of the depression. Anxiety disorder, ADHD, alcohol, drugs, and drug problems, physical health problems such as heart disease, thyroid problems, and headaches. Adrenaline is linked to this disorder, so your body may release adrenaline in bad times, and it may cause heart problems. Next slide. How to prevent bipolar disorder. There's no sure way of preventing it. You just the best thing that you can do is look out for the risk factors. However, getting treatment at the earliest stage of the mental disorder is important. Pay attention to the warning signs and the prevention. If there's any symptoms of bipolar disease, you need to seek medical attention. Avoid drugs and alcohol. Hopefully we're good in here. Take your medication exactly as directed. This is after you have been diagnosed with bipolar disorder. Next slide. Diagnose. How do they diagnose a person with bipolar disorder? What's the difference between a normal mood swing and a bipolar mood swing? First of all, physical exam. They check on you. They check if you have any medical problems that could cause any of the symptoms. They check your brain. Psychiatric assessment. Your doctor may refer you to a psychiatrist who will talk to you about your thoughts, feelings, and behavior patterns. So you talk with a psychiatrist or psychologist, and they assess your mental health, and through just chatting with them and talking about how you feel. Mood charting. You may be asked to keep a daily record of your moods, sleeping patterns, or other factors that could help in diagnosis. So, as we know, the symptoms of bipolar disease is mood swings, and one of the symptoms is sleeping problems. So, if you keep track of sleeping problems or the mood swings, you may be able to identify if you have bipolar disease or not. Criteria for bipolar disorder: the DSM-5 criteria. We didn't put that in the presentation now, but you can find it in the internet. Says a level of symptoms, a minimum amount of symptoms that if you have them, you have bipolar disorder. Next slide. Diagnosis in children. Although diagnosis of children and teenagers with bipolar disorder includes the same criteria that are used for adults, symptoms in children and teens often have different patterns and may not fit neatly into the diagnostic categories. So it's hard to tell with children if they have bipolar disease. It's harder than adults, at least. Also, children who have bipolar disorder are frequently also diagnosed with other mental health conditions. So if you can tell, you can diagnose bipolar disorder through other activities, other conditions such as ADHD and behavior problems, which may cause diagnosis more complicated. So you can also refer to a psychiatrist to assess the child. Next slide. Treatment is best guided by a medical doctor. So they may give you medications, and just like other mental diseases that we've talked about, either like oral medication and talking to a psychiatrist or a certain expert at this thing, or there's continued treatment where it's usually drugs. Good drugs. So yeah. Next slide. Other is day programs. Your doctor may recommend a day treatment program. These programs provide the support and counseling you need while you get symptoms under control. So just certain activities that you can do to help control the symptoms. Substance abuse treatment. If you have problems with alcohol or drugs, so this is referring to the alcohol or drug-related bipolar disorder. That's one that we talked about, and they put you under a program to help manage this disorder. Hospitalizations. Your doctor may recommend hospitalization if you're behaving dangerously, you feel suicidal. Okay, so to help prevent, if it's becoming a really severe case, hopefully before anything tragic happens, they hospitalize you. Hospitalization is when you live in the hospital, basically, and you get treatment straight away. If you have suicidal thoughts or if extreme mania, in which you're doing a lot of weird decision making, they may make you sleep at the hospital and stabilize your mood. The primary treatment for bipolar disease includes medication and psychotherapy to control symptoms, as I said before. Continue.
So you can take medications based on their symptoms, which includes mood stabilizers. To control manic or hypomanic episodes, you will need mood stabilizers such as lithium, valproic acid, and the rest. You will also need antipsychotics, which are medications to treat psychosis, because bipolar could lead you to psychosis. And psychosis is a condition that affects the way your brain processes information, causes you to lose touch with reality. You might see, hear, or believe things that aren't real. Antidepressants, more pills and drugs that your doctor may use. Antidepressant and psychotic, which works for both mood stabilizer and as a depression treatment. Anti-anxiety medications, such as benzo, may help with anxiety and improve sleep, and is usually used for a short-term basis. There are side effects for medications. Talk to your doctor if you have bothersome side effects. Don't stop taking medications until the time asserted by your doctor is reached. Your symptoms may worsen or return if you stop taking medications before the required time. You may become very depressed, have suicidal thoughts, or go into a manic or hypomanic episode. Psychotherapy is a vital treatment for bipolar disorder. It can be provided by an individual, family, or group settings. Types of therapy may include interpersonal and social rhythm therapy. It focuses on the stabilization of daily rhythms such as sleeping, walking, and mealtimes. People with bipolar disorder may benefit from establishing a daily routine for sleep, diet, and exercise. Cognitive behavioral therapy focus on unhealthy negative beliefs and behaviors and replacing them with positive ones. That's what cognitive behavioral therapy does. It will also learn effective strategies to manage stress and to cope with upsetting situations. Psychoeducation. Learning about bipolar disorder and its effects can help you cope with it. Knowing what's going on can help you get the best support, identify issues, and make a plan to prevent relapse and stick with treatment. Family focused therapy. Family support and communication can help you stick with your treatment plan and help you and your loved ones recognize and manage warning signs of mood swings. You can also use convulsive therapy. In this therapy, electrical currents are passed through the brain, intentionally triggering a brief seizure. ECT make changes in your brain chemistry that can reverse symptoms. ETC can be an alternative for medication. There is also a transcranial magnetic stimulation is for those who haven't responded to antidepressants. And now we'll watch a video about the ECT. Can you hear the volume?
Yeah,
Hello? Okay, good.
it's audible.
Electroconvulsive therapy, or ECT, is often called a treatment of last resort for patients who haven't had success with drug therapies, who have life-threatening psychiatric conditions, or who are suffering a catatonic state. ECT induces a brief seizure in a patient which resets the brain functions associated with some psychiatric disorders.
It's typically indicated for treatment-resistant psychiatric conditions, most commonly mood disorders or depression, but there are multiple types of depression, so it can also be used to treat bipolar depression.
The majority of ECT treatments are managed like outpatient procedures, and the patient is given general anesthesia.
When the patient's asleep, the stimulus is delivered, the seizure is monitored, they'll have just one seizure.
An electrical current is given to the brain, low enough not to harm the patient, but high enough to trigger a seizure. The treatment team can even touch the patient.
The thing that concerns patients the most is that they know that they will be having a seizure. They're concerned about what may be happening while they're either asleep or while they're having that seizure. And thanks to the anesthetic, it's very hard to tell. In fact, only way you can truly tell if they're having a seizure or not is to kind of monitor the motor activity and then monitor the EEG activity.
The patient awakens soon after and is monitored for a short while like any patient who has undergone general anesthesia. Within a half hour, they'll be discharged. In some cases, a handful of ECT treatments may be all that's needed to make medication therapy work. For other patients, regular recurring ECT treatments may be needed. In Morgantown for the WVU Health Report, I'm Dr. Raleigh Sullivan.
Another video for the transcranial magnetic stimulation.
TMS, or transcranial magnetic stimulation, is a non-invasive, non-drug treatment for depression recently cleared by FDA. A TMS is a treatment that is approved for adult patients, age 18 and above, who are still suffering from depression and have not responded to antidepressant medication use. It's not like the old movies where you may have seen somebody's getting shocked. The patient is sitting in a very nice, comfortable chair. Patients are awake the whole time, and the magnetic coil, which sets on the left side of the head, is stimulating the underactive parts of the brain that are affected in depression. The pulse feels like a tapping sensation on the side of the head where the coil is placed. This procedure takes about 37 minutes, and the treatment is on for 4 seconds and then off for 26 seconds. It is relatively pain-free procedure, although patients may experience some minor discomfort on the head where the device is placed. TMS is free of side effects commonly associated with antidepressant medication use. Significant improvement is seen 1 in 2 patients, and 1 in 3 patients are symptom-free after 4 to 6 weeks of treatment. If the medications are not working, one is still depressed and experiencing side effects of the medications, and depression is interfering in your life, TMS may be right for you.
Treatment for children depends on symptoms, medication side effects, and other factors. They often prescribe the same medications as those of adults. And they might need psychotherapy. It can help them manage their daily routines, develop coping skills, address learning difficulties, resolve social problems, and help strengthen family bonds and communication. They also need psychoeducation, as we talked about, and they need support from their teachers, family members, or friends to identify service and encourage success. Lifestyle change is important to stop bipolar disorder, which includes quitting smoking or using recreational drugs. Get help if you have trouble quitting on your own. Form healthy relationships. Surround yourself with positive influences. Create a healthy routine. Having a regular routine for sleeping, eating, and physical activity can help balance your mood. Eat a healthy diet. If you have trouble in these, talk to your doctor or mental health professional about what you can do. Check first before taking any other medications. Make an app or on or call your doctor before taking any medication for bipolar disorder. Consider keeping a mood chart, keeping a record of your daily moods, treatments, sleep, activities, and feeling may help identify things that cause your bipolar disorder. If you choose to use alternative medicines, in addition to as a physician recommended treatment, take some precautions, but don't stop taking your prescribed medications or skip therapy sessions because alternative medicines is not a substitute for normal medical care. Be honest with your doctor and mental health professional. Tell them exactly which alternative medicine you would like to try. Be aware of potential dangers. Just because alternative medicine is natural doesn't mean it's safe. Talk to your doctor about the risks of these medications.